Right now, there's very few physicians I know who are in the public space that have not received death threats.
Wondering what it's like to be a Canadian medical doctor during COVID-19? Well, just head to Twitter. Check out the replies when the president of the Canadian Medical Association shares new calls Thursday to address online and in-person attacks against healthcare workers. She's called a lunatic, accused of abusing her child, and that's nowhere near the worst of it.
Social media platforms allow this type of violence to happen online, that it emboldens people to take it to a physical and personal level.
Patients scratching, swinging at me, pinching me as they come in and out of their anesthetics while I'm in the OR. I experience, threats and intimidation from patients who don't like what's going on in the healthcare system right now or from their families.
Working as an anesthesiologist, Dr. LaFontaine says he's dealt with attacks from patients throughout his career, but during the pandemic, it's been escalating.
As a provider, I'm really coming into people's lives at the lowest point of kind of where they're at. But even in that context, what people are now doing, and my experiences are not unique. They're very common across the country. People have now been emboldened to do things that I don't think should be seen as normal.
The CMA calling on the Prime Minister to speed up his promises from this fall following protests outside of hospitals to create a criminal code offense for threatening, harassing, and intimidating a healthcare worker, both in person and online. They're also working with tech giants like Twitter, Facebook, and YouTube to create an action plan.
I've experienced them, but I'm the first one to say that my female colleagues, especially online, deal with a much more severe, misogynistic, often racialized for those who have racialized backgrounds.
So creating safe spaces for people to work in physically, but also for people to advocate online, I think are really important to addressing burnout and moral injury.
Hopeful that in adjusting the criminal code, society will take a stand against the targeting of those working in healthcare.
Really hoping that one of the legacies of this pandemic is not normalizing the bad behavior that's become very, very common across the healthcare system.
In Edmonton, Carly Robinson, City News.